Good evening, students. Today we'll see about case scenario. Okay, a 40 years old male patient is a alcoholic. Patient is a building contractor workers. Okay, severe pain in the last 3 months of the right side hip region. Okay, patients have a history of alcoholic. Okay, then smoker. Okay, then severe pain on the right side hip joint and unable to walking. Okay, unable to walking. Okay. So during this condition, which type of surgery approach is prescribed for this patient? Okay.
Hi, I'm Emmanuel Benjamin Thomas, pursuing my fourth year of physiotherapy in Snscopt of physiotherapy. So, as per your conditions, I assume that the patient had a hip fracture because of the, as he is a alcoholic person, he might have fall due to undergone fall. So there could be some kind of fracture in the hip joint. So I assume that it is a hip joint. So we can proceed with the total hip replacements or arthroplasty for the condition.
One thing is not fall history. Not fall history. Patient combines only alcoholic and smoker. Okay. Smoker then hip severe pain, severe right side hip pain, and unable to walking. During walking, its pain is present. Okay. Not fall history, not history. 40 years.
Sir, if it is the condition, then I will proceed with the X-ray, sir.
What is the condition? Diagnosis.
Yes, sir. Investigation, we will use X-ray only, sir. So, what is the result from the X-ray, sir? Sir, is there any particular condition which is seen in the X-ray, sir?
Is in tonic all alkali smoking conditions. What is the important factors for the joint?
Avascular necrosis.
In avascular necrosis around the hip joint. That only causes the pain around the hip joint. Okay. Then laterally it's progress the weight bearing is affected. Walking is affected. Okay. Then that kind of situation only you will choose for surgical method. Yeah, so this condition is for avian, right side hip avian. Okay. So then we'll choose for what type of approaches is for surgery.
Okay, so since the part which is not vascularized, so we have to remove that particular part, sir. So we can proceed with hemiarthroplasty or total hip replacement, sir.
The other causes would be osteoarthritis or rheumatoid arthritis or if any failure of conservative or surgical treatment, sir. Then should be it's avascular necrosis is in chronic stage. Then it should be given to a treatment of surgical, sir.
The methods of THR is cemented, uncemented, hybrid. Sir, cemented is most commonly done for elderly people below 65 years. During cemented THR, we can be weight bearing immediately, sir. During non-cemented is done for younger adults. It is 6 week. We should not weight bear, sir. Third type is hybrid. Non-cemented is cemented. Cemented. Hem, hemiarthroplasty.
Hi, I'm Sneha, pursuing fourth year by BPT student. There are several approaches in THR, excision arthroplasty, biological arthroplasty, replacement arthroplasty, or excision arthroplasty with implants. There are various approaches like this TKR.
In this case, which type of existential or biological existential or interpersonal or revision?
Replacement arthroplasty. Arthroplasty.
Total or
Hemiarthroplasty.
Only the femoral.
what are the any other plastic post-operative
Sir, at the day one, uh, in that day they were in ICU, sir, and the operated day. In that stage, they will do ankle pumps movement for blood circulation. Then, in after the surgical day, at the day one, ankle pump movements and the isometrics of knee joint, glutes, and all given. Then at the day two, at the bedside, we have to give the isometric exercise, then unilateral pelvic bridging, then partial weight bearing, and then with the help of walker, they will walking around the bed. These and all given, sir.
What is maybe total
Non-weight bearing, sir. Okay. Then assisted active movements should be given, sir. That's
competitions?
Post-surgery, there may be complications such as deep vein thrombosis, pulmonary embolism, sciatic nerve palsy, femoral nerve palsy, limb length discrepancy, and infection.
Sir, hi, I'm Akash, final year BBD student. So, do's and don'ts of total hip replacement, I would explain. For do's, we should prevent muscle contractures like hip flexion contracture by positioning the patients in a prone position or lowering the leg in the bed, tilted bed. So, and for don't, we should not flex the hip, internally rotate the hip or adduct the hip, sir. And I want to add some contraindications for THR patients. So if he has neuropathic joints or active infections or like chronic osteomyelitis, malignant tumors, we should not go for arthroplasty or total hip replacements.